Can bone cancer limb-sparing surgery save limbs? When it comes to bone cancer, a common question arises. Can limb-sparing surgery save limbs? The answer is yes. Limb-sparing surgery, also known as limb salvage surgery, is a surgical technique that can effectively save limbs in many patients with bone cancer, especially those with tumors located in the arms or legs that can be surgically removed. This approach focuses on removing the cancerous tumor while preserving as much of the limb's function and appearance as possible, which is a significant advantage over amputation. Research shows that limb-sparing surgery can lead to excellent outcomes in terms of cancer control and survival rates. In fact, studies indicate that patients who undergo this type of surgery often have better overall survival and disease-specific survival compared to those who have an amputation, particularly in cases of early-stage primary bone tumors. For instance, patients with tumors classified as T1 or T2 stage, including common bone cancers like osteosarcoma, have shown improved survival rates. One large study found that limb-sparing surgery was associated with a 30 to 40% reduction in mortality risk compared to amputation. While limb-sparing surgery has many benefits, it is important to note that it can carry a higher risk of local recurrence of cancer compared to amputation. This is because amputation removes the entire limb and more surrounding tissue, which can help ensure that all cancer cells are eliminated. However, advancements in chemotherapy and surgical techniques have improved disease-free survival rates for patients who undergo limb-sparing surgery. Many patients achieve long-term remission and maintain good functional outcomes after their treatment. The 5-year survival rates after limb-sparing surgery combined with chemotherapy can range from about 60 to 75% for localized bone cancer, particularly osteosarcoma, which is the most common primary bone tumor in young people. Limb-sparing surgery often involves complex reconstruction techniques, including the use of custom-made prostheses or bone grafts, to restore limb function after the tumor has been removed. These reconstructions have shown reasonable long-term durability, allowing patients to retain mobility and use of their limbs. In summary, limb-sparing surgery is a valuable and often preferred treatment option for patients with resectable bone cancers in the limbs. It not only has the potential to save the limb but also provides survival outcomes that can be equal to or better than those achieved through amputation. Moreover, it helps maintain a better quality of life and limb function. The decision between limb-sparing surgery and amputation depends on various factors, including tumor size, location, response to chemotherapy, and the overall health of the patient. Therefore, a personalized evaluation by a multidisciplinary medical team is essential to determine the best surgical approach for each individual. Always consult healthcare professionals for advice tailored to your specific situation.